Men, listen. You can't fake confidence when your body won't back it up. Erectile dysfunction isn't about manhood. It's about health. I'm Dr. Dibby. And if you're having trouble getting or keeping an erection, you're not alone, and you're not broken. 1 in 3 men over 40 experiences ED. But here's what they don't tell you. It's not always about sex. Sometimes it's your heart. Sometimes it's your hormones. Sometimes it's your mind. What causes ED? Poor blood flow. From diabetes, high blood pressure, or clogged arteries, low testosterone, stress, anxiety, depression, smoking, alcohol, obesity, even medications you're taking. Now here's the good news. It's treatable. Depending on the cause, we can manage ED with lifestyle changes, more sleep, exercise, less alcohol, oral meds like Viagra or Cialis, testosterone therapy, if levels are low, counseling or therapy for performance anxiety, and in serious cases, medical procedures or implants. But here's the real problem. Most men wait too long. They suffer in silence. They blame themselves. They pull away from their partners. You don't have to. ED is a signal, not a sentence. It's your body saying, hey, something's off. Let's fix it before it gets worse. If you're experiencing erectile dysfunction, talk to your doctor. Don't Google it. Don't hide it. Don't drown in shame. Take control. Tag a brother. Share with your man. Save a life and a relationship.